Hi, my name is Olivia Toner, and today I'm going to be discussing with you the topic of valid consent and the nurse's role for advocating for a patient without informed consent. In an article for AT1 Journal, Peterson refers to informed consent as the process that identifies the surgical or procedural treatment to be performed for the patient. Through further research, I found that three main components validate consent, those being disclosure, comprehension, and valid agreement. Patients must have the capacity to give valid consent, which is usually achieved through the discussion process. During a discussion between a physician and patient, there is a sharing of crucial information. This includes information regarding diagnosis, prognosis, treatment options, risks, benefits. The physician also provides their own opinion and recommendations. In order to achieve self-determination for the patient, they are also encouraged to share their own values and preferences and healthcare goals, therefore giving the patient their own choice. The ultimate aim of the discussion process is to establish an agreement where the patient is free to make a decision voluntarily, as read in an article by Helen Sharp. The patient's signature signifies the culmination and formalization of the preceding discussion. However, it is important to recognize the possibility of patient choice to change. This is as a result of altering patient condition, such as deterioration or improvement. The process of gaining consent is purposeful in approach, as healthcare professionals seek to maintain patient dignity and respect and provide patient-centered care. This is achieved, as previously mentioned, through the sharing of information and patient education, allowing the patient to ask questions and understand alternative courses of treatment. Furthermore, it's important to note that patients do have a right to refuse, as without a right to refuse, informed consent is meaningless and self-determination becomes impossible, as quoted from an article by Peterson. Through research, particularly from an article by Hines, it becomes evident that patient vulnerability necessitates advocacy. Most commonly in the case of perioperative nursing, as patients undergoing surgery are often induced to a state of unconsciousness, therefore causing impaired communication and affecting ability to make rational, educated decisions. Ultimately, the nurse acquires responsibility and so is required to speak on the patient's behalf and act as a surrogate for their decision-making. The necessity of nurses to act as an advocate is highly due to the restricted environment of the operating theatre, as no relatives or next of kin are able to take the journey with them. The vital role of the nurse as an advocate for a patient without informed consent is to ensure the patient's needs are met in accordance to their initial healthcare goals. The nurse as an advocate also obtains the responsibility of providing safe care by planning ahead and safeguarding the patient from harm, including risk identification and patient guidance. Every action has a purpose and a goal, all which contribute to achieving a successful healthcare plan. A qualitative design analysis exhibited the following information. Many of the registered nurse anaesthetists in the analysis perceived advocacy as defending a patient, and the term vicarious autonomy was common throughout the article, where one RNA, in relation to such a term, described herself as a link or an extension of the patient to the surrounding world. Thank you for listening to my presentation. I hope you enjoyed it, and please find a list of my references in my portfolio. Thank you.